there are a number of the concerns that you've raised this morning that I share. I think hospital costs are high and they're soaring higher. The problem is when you talk about new bills that need to pass, the bills you propose to address any of these problems don't get to the core of the problem. The leading bill that this administration pushed was to give more price disclosure information, which is unlikely to have a significant impact on desperate sick people seeking care. The site neutrality provision may have some merit. It's a fairly narrow focus. And at the same time, you talk about new bills that need to pass, where there are actions this committee could take that would make a real difference, you obstruct and block consideration of the legislation. That's why I agree with Mr. Neal that this is more a deflection hearing than a hospital hearing. Let's talk about 3 areas that are being blocked and obstructed that could make a real difference in accord with the testimony we've heard this morning. The first one is stable coverage. This is a committee and an administration that has done more to take away health care coverage from American people than any in American history. And what happens is, as Mr. Hassan indicated, is that when people don't have stable coverage, when their Medicaid's taken away, when they can't afford their marketplace plan, they don't get treatment when they need it. And so they show up in the emergency room. And some of those folks are going to show up in the emergency room and they don't have anything to pay the bill. And the hospital can't pay its nurses and physicians and its staff and its administrative cost with an IOU. It needs to pass those costs along to all the rest of us who have decent insurance plans. The lack of stable coverage that is the direct responsibility of this committee and the Trump administration in those cuts is having a huge impact on hospital costs and on costs that are borne by all of us. The second area where this committee could do something but refuses to act and obstructs those of us who want to act is with regard to pharmaceuticals. The Trump RX is as phony as a diploma from the failed Trump University. This committee is under a stranglehold by Big Pharma. It won't even hold a hearing on the actions of pharmaceutical manufacturers. And yet, as Dr. Donnelly has pointed out, and I'm sure it's true in some of the other systems, in 1 year, the drug cost at his hospital went up over 25%. You cannot deal with high hospital costs unless you look at pharmaceutical costs, and this committee refuses to do it. And the third area where we can't get action is Medicare Advantage. And we've had testimony this morning about what a difference that makes. Let me ask you, Mr. Lassiter, a little more about that. I've authored the bipartisan prompt and fair pay. And when I talk about Republicans, I'm not talking about all Republicans. Dr. Murphy, Dr. Harris, Chuck Edwards, Congressman Thompson have all joined in that effort to get prompt and fair pay. You mentioned that at your hospital, how many $1 billion is it that you have in bills that Medicare Advantage has not paid?
Thank you, Congressman Doggett. We have $4.3 billion
$4.3 billion
unpaid claims for Medicare Advantage.
Well, our bill is one that is focused on getting prompt and fair payment. We learned in prior hearings that sometimes Medicare Advantage doesn't even pay the cost of traditional Medicare in reimbursing for healthcare services. You mentioned your support for this prompt and fair pay bill that we've introduced on a bipartisan basis in your written testimony. Can you describe some of the difficulties that you've been having there?
Yes, sir. I would say yes. I would say thank you to you and to Representative Arrington for sponsoring the Prompt Pay Act bill. We are supportive. As I mentioned in my testimony, we have significant unpaid claims, and we have claims about $1 billion that are over 150 days old. I would say that for Medicare Advantage, it costs us 25% more to process a Medicare Advantage claim than it does traditional Medicare. And we also suffer, as you indicated, from the fact that the reimbursement level for Medicare Advantage patients oftentimes does not cover the full cost of care. That is correct, sir. Thank you.
Thank you.